Hi, welcome to Professional Certifications channel. Let's break down RHIT exam preparation, one topic a day for focused and effective learning. Today's topic is machine learning.
Definition: Machine learning, ML, in healthcare refers to the use of algorithms and statistical models that enable computers to learn from and make predictions or decisions based on data, without being explicitly programmed. In healthcare, ML is used to analyze large datasets, identify patterns, and make data-driven predictions that support clinical decision-making, improve patient outcomes, and optimize healthcare operations. ML applications include disease diagnosis, predictive analytics, personalized treatment plans, medical imaging analysis, and drug discovery. Machine learning is a subset of artificial intelligence, AI, that improves its performance over time as it is exposed to more data, helping healthcare providers make more informed and accurate decisions.
Key types of machine learning in healthcare. 1. Supervised learning. In supervised learning, the algorithm is trained on a labeled dataset, where the input data and corresponding output, or labels, are known. The model learns to map inputs to outputs and is then used to predict outcomes for new, unseen data. Example: a supervised learning algorithm is trained on labeled medical images to distinguish between cancerous and non-cancerous tissues. After training, it can analyze new medical images and classify them as cancerous or not. 2. Unsupervised learning. In unsupervised learning, the algorithm works with unlabeled data, identifying patterns or structures within the data without any predefined outputs. It is often used for clustering, anomaly detection, and discovering hidden patterns in large datasets. Example: unsupervised learning can be used to analyze patient data and group patients into clusters based on similarities in their medical history, symptoms, or treatment outcomes, without knowing the specific categories beforehand. 3. Semi-supervised learning. Semi-supervised learning is a combination of supervised and unsupervised learning. It uses a small amount of labeled data along with a larger amount of unlabeled data to improve learning accuracy. This is useful in healthcare, where labeled data may be scarce, but there is an abundance of unlabeled data. Example: a semi-supervised learning algorithm might be used to predict disease outcomes by combining a small set of labeled patient records with a large set of unlabeled health data to improve the accuracy of predictions. 4. Reinforcement learning. In reinforcement learning, the model learns by interacting with an environment and receiving feedback in the form of rewards or penalties. The model aims to maximize its cumulative reward by learning the best actions to take in different situations. Example: reinforcement learning can be applied in robotic surgery, where a robotic system learns to perform specific surgical tasks by receiving feedback based on its performance, improving over time. 5. Deep learning. Deep learning is a subset of machine learning that uses artificial neural networks with many layers, hence, deep, to model complex patterns in data. It is particularly effective for analyzing large datasets, such as medical images or genomic data. Example: deep learning algorithms can be trained to analyze MRI scans to detect brain tumors or identify signs of retinal disease in eye scans.
Applications of machine learning in healthcare. 1. Disease diagnosis and detection. Machine learning is used to analyze medical data, such as images, lab results, and clinical notes, to detect diseases earlier and more accurately. ML models can help identify patterns that are difficult for human clinicians to recognize, improving diagnostic accuracy. Example: ML algorithms can analyze mammograms to detect early signs of breast cancer or use retinal scans to identify diabetic retinopathy. 2. Predictive analytics for patient outcomes. Predictive analytics models use machine learning to predict patient outcomes, such as the likelihood of disease progression, hospital readmission, or response to treatment. This helps healthcare providers take preventive actions and personalize treatment plans. Example: ML models can predict which patients are at high risk of developing sepsis in the ICU, enabling early intervention and potentially saving lives. 3. Personalized medicine. Machine learning analyzes genetic, clinical, and lifestyle data to recommend personalized treatment plans for patients. By identifying patterns in patient data, ML can predict how individuals will respond to certain treatments, enabling more effective and tailored care. Example: ML models can analyze genetic mutations in cancer patients to recommend targeted therapies, improving treatment efficacy and reducing adverse side effects. 4. Medical imaging analysis. Machine learning, especially deep learning, is widely used in medical imaging to assist radiologists in diagnosing diseases from X-rays, CT scans, MRIs, and ultrasounds. These models can detect abnormalities, such as tumors or fractures, with high precision. Example: a deep learning algorithm can be trained to identify lung nodules in chest CT scans, assisting in the early diagnosis of lung cancer. 5. Natural language processing, NLP, in EHRs. Machine learning techniques are used in natural language processing, NLP, to analyze unstructured clinical data, such as physician notes or discharge summaries, in electronic health records, EHRs. NLP helps extract valuable insights and support decision-making. Example: NLP can be used to identify potential medication errors by analyzing unstructured text in patient records and flagging inconsistencies between prescribed drugs and documented diagnoses. 6. Drug discovery and development. Machine learning accelerates drug discovery by analyzing large datasets of chemical compounds, molecular structures, and clinical trial results. ML models predict how new compounds will interact with biological targets, speeding up the development of new drugs. Example: ML algorithms can predict the effectiveness of drug candidates in treating diseases like Alzheimer's by analyzing molecular and genomic data. 7. Remote monitoring and wearable devices. Machine learning is used to analyze data from wearable devices, such as heart rate monitors and fitness trackers, to monitor patients' health in real time. ML models can detect anomalies in vital signs and alert healthcare providers to potential health issues. Example: ML models can analyze data from continuous glucose monitors to predict blood sugar fluctuations in diabetic patients, allowing for timely interventions. 8. Clinical Decision Support Systems, CDSS. Machine learning enhances clinical decision support systems by providing evidence-based recommendations for diagnosis, treatment, and care management. These systems analyze patient data to support healthcare providers in making informed decisions. Example: an ML-powered CDSS can recommend appropriate antibiotics based on a patient's symptoms, lab results, and medical history, reducing the risk of prescribing errors. 9. Population health management. Machine learning helps healthcare organizations manage population health by analyzing large datasets to identify patterns and trends in health outcomes. This enables healthcare providers to design targeted interventions and preventive care strategies for at-risk populations. Example: ML models can identify high-risk populations for chronic diseases like diabetes or hypertension and recommend community-based interventions to improve health outcomes.
Benefits of machine learning in healthcare. 1. Improved diagnostic accuracy. Machine learning models can analyze large amounts of medical data to detect patterns and abnormalities that might be missed by human clinicians. This leads to earlier detection of diseases and more accurate diagnoses, improving patient outcomes. 2. Enhanced personalization of treatment. ML allows healthcare providers to tailor treatment plans to individual patients by analyzing genetic, lifestyle, and clinical data. Personalized medicine improves treatment effectiveness and reduces adverse reactions by considering the unique characteristics of each patient. 3. Faster data analysis. Machine learning algorithms can process and analyze vast amounts of data in a fraction of the time it would take for human experts. This speeds up tasks such as image analysis, drug discovery, and predictive analytics, enabling faster decision-making and treatment. 4. Predictive analytics for preventive care. Machine learning models can predict future health events, such as disease progression or hospital readmissions, allowing healthcare providers to take preventive actions. This helps reduce hospital admissions, improve patient care, and lower healthcare costs. 5. Operational efficiency. Machine learning optimizes healthcare operations by improving resource management, automating administrative tasks, and streamlining workflows. For example, ML models can predict patient flow and optimize staff scheduling, reducing wait times and improving patient care. 6. Accelerated drug discovery. Machine learning accelerates the drug discovery process by analyzing large datasets and predicting the effectiveness of new drug candidates. This reduces the time and cost of bringing new treatments to market and opens up possibilities for treating previously untreatable conditions.
Challenges of machine learning in healthcare. 1. Data privacy and security. Machine learning models require access to large amounts of healthcare data, raising concerns about data privacy and security. Healthcare organizations must ensure that data used for ML is protected and that patient privacy is maintained in compliance with regulations like HIPAA. 2. Bias in machine learning algorithms. If the data used to train machine learning models is biased or not representative of the broader population, the model's predictions may also be biased. This can lead to unequal or inaccurate treatment recommendations, particularly for underrepresented patient groups. 3. Data quality and availability. Machine learning models rely on high-quality, accurate, and comprehensive data. Incomplete, inconsistent, or erroneous data can negatively impact the model's performance and lead to incorrect conclusions. Ensuring data quality is a significant challenge in healthcare. 4. Interpretability and transparency. Many machine learning models, especially deep learning models, function as black boxes, making it difficult to understand how they arrive at their predictions. This lack of transparency can make it challenging for clinicians to trust or validate AI-driven recommendations. 5. Integration with existing systems. Implementing machine learning solutions in healthcare requires integration with existing health IT systems, such as EHRs. Ensuring seamless integration and interoperability between machine learning models and healthcare systems is a technical challenge. 6. Regulatory and ethical concerns. The use of machine learning in healthcare raises regulatory and ethical concerns, particularly around the approval and oversight of AI-driven tools. Ensuring that machine learning models meet safety and efficacy standards is essential for protecting patients. 7. Limited access to large datasets. Machine learning models require large, diverse datasets for training and validation. However, accessing these datasets can be challenging due to data silos, privacy concerns, and fragmented healthcare systems.
Best practices for implementing machine learning in healthcare. 1. Ensure data privacy and compliance. Use anonymized or de-identified patient data whenever possible, and ensure compliance with healthcare privacy regulations like HIPAA. Implement robust data security measures, such as encryption and access controls, to protect sensitive health data. 2. Use diverse, high-quality data. Train machine learning models using diverse, high-quality data that represents different patient populations and clinical scenarios. This reduces the risk of bias and ensures that the models are generalizable and applicable in real-world healthcare settings. 3. Monitor model performance and bias. Continuously monitor the performance of machine learning models to ensure they are making accurate and unbiased predictions. Regularly test the models on new, unseen data and evaluate their performance across different patient demographics. 4. Integrate ML with existing workflows. Ensure that machine learning solutions are integrated seamlessly with existing health IT systems, such as EHRs, and that they fit within clinical workflows. This reduces the burden on healthcare providers and ensures that ML tools enhance, rather than disrupt, care delivery. 5. Provide training and education. Train healthcare providers and staff on how to use machine learning tools effectively. Ensure that clinicians understand the strengths and limitations of the models and provide clear guidelines on how to interpret and apply AI-driven insights in clinical practice. 6. Collaborate with regulatory bodies. Work with regulatory bodies to ensure that machine learning models used in healthcare meet safety, efficacy, and ethical standards. This helps build trust in AI-driven tools and ensures that they are used responsibly in clinical settings.
Future trends in machine learning in healthcare. 1. AI-powered drug discovery. Machine learning will continue to play a central role in accelerating drug discovery and development. ML models will be used to predict the efficacy of drug candidates, identify new drug targets, and optimize clinical trial design. 2. Real-time predictive analytics. Machine learning will enable real-time predictive analytics in healthcare, allowing clinicians to monitor patients continuously and predict health events such as cardiac arrests or sepsis. Wearable devices and remote monitoring tools will generate real-time data for analysis. 3. Genomics and personalized medicine. ML models will analyze genomic data to develop personalized treatment plans based on a patient's genetic profile. This will enable precision medicine, where treatments are tailored to individual patients for optimal outcomes. 4. Automated diagnostics. Machine learning will enhance automated diagnostic tools, enabling more accurate and faster diagnoses in fields such as radiology, pathology, and dermatology. AI-driven diagnostic systems will support healthcare providers in delivering high-quality care. 5. Natural language processing, NLP, for clinical documentation. NLP will play a larger role in automating clinical documentation, extracting valuable insights from unstructured text in EHRs, and reducing the administrative burden on healthcare providers. 6. AI-driven robotics in surgery. ML-powered surgical robots will continue to evolve, enhancing the precision and control of minimally invasive surgeries. Robots equipped with machine learning algorithms will assist surgeons in performing complex procedures more safely and accurately.
Conclusion. Machine learning is transforming healthcare by improving diagnostics, personalizing treatment, optimizing operations, and accelerating drug discovery. While ML offers tremendous potential to enhance patient care, its successful implementation requires addressing challenges related to data privacy, bias, and integration. For RHIT exam aspirants, understanding the role of machine learning, its applications, challenges, and best practices is essential for supporting data-driven healthcare innovations and improving healthcare delivery.